Are you struggling with alexithymia and emotional awareness? Imagine feeling something but not quite knowing what it is. That's often what people with alexithymia experience. It's a condition where identifying, understanding, and expressing emotions can feel really difficult. If you have PTSD or trauma history, you might notice this more. Trauma can cause emotional numbing, making it harder to feel or recognize your feelings. This is where alexithymia and PTSD often intersect, creating a complex challenge for recovery. People with alexithymia often find it hard to tell what they are feeling. They may experience physical sensations like tight muscles or stomach discomfort but not connect these to emotional states. Their emotional vocabulary is limited, so describing feelings like sadness or anger can be tough. They might also struggle to read emotions in others, like facial expressions or tone of voice, which makes social interactions harder. This difficulty can lead to feeling isolated or misunderstood. In the context of PTSD, emotional numbing is a common symptom. It's a protective response where the brain disconnects from feelings to avoid pain. About 42% of people with PTSD show signs of alexithymia. When trauma occurs, the brain may unconsciously shut down emotional responses to cope with overwhelming experiences. This shutdown can become a long-term pattern, especially if trauma is chronic or intense. It's a way the brain tries to protect itself but can also make emotional processing and healing more complicated. Trauma can influence the development of alexithymic traits through mechanisms like avoidance and dissociation. When someone avoids emotional triggers or dissociates during traumatic events, they create a barrier between themselves and their feelings. Over time, this can lead to a persistent difficulty in recognizing or understanding emotions. Hyperarousal and emotional overload can also cause the brain to shut down emotions as a form of self-protection. The longer trauma lasts, the more likely these emotional awareness issues will persist, making recovery more challenging. The brain regions involved in emotional awareness include the anterior insula, which helps interpret physical signals like a racing heart, and the amygdala, which detects fear and threat. The frontal lobes help label and regulate emotions. When trauma disrupts these areas, emotional awareness can suffer. For trauma survivors, feeling unsafe or overwhelmed often leads to emotional shutdown as a coping strategy. This can make it hard to connect with feelings or process traumatic memories effectively. This difficulty impacts treatment because traditional talk therapy relies on verbalizing feelings. If you find it hard to identify or describe your emotions, engaging in therapy can feel frustrating or unproductive. Without emotional awareness, it's harder to process trauma and work through difficult memories. This can lead to ongoing symptoms of PTSD or depression. However, understanding these challenges allows therapists to adapt their approaches. Techniques like eye movement desensitization and reprocessing, or somatic experiencing, focus on working with the body and sensations rather than just words. Mindfulness and emotional skills training can also help gradually build awareness over time. About 10% of the general population experiences alexithymia, but it's more common among those with PTSD. In some groups, such as people who have experienced prolonged trauma, the prevalence can be over 50%. Recognizing these traits in yourself might mean noticing that you struggle to name feelings, feel disconnected from your emotional life, or focus mainly on physical sensations. You might seem emotionally distant or have a limited facial expression. Understanding that these experiences are common in trauma survivors can be a helpful first step. If you think you might be dealing with alexithymia, know that help is available. Working with trauma-informed mental health professionals can make a big difference. They can tailor approaches to your needs, helping you develop emotional awareness gradually. Techniques that focus on the body, like somatic therapies, can be especially helpful. Journaling or expressive writing can also encourage reflection and help connect thoughts to feelings. Remember, building emotional awareness takes time, but with support, it is possible to improve your understanding of your feelings and enhance your recovery from trauma. Always consult healthcare professionals for personalized advice and guidance tailored to your unique experience.
you.